Welcome to Behind Our Health Life podcast, a podcast about things that matter the most, our health. A healthy life for citizens, youth, and children alike. We need to reimagine, restructure the healthcare policy and a system that will protect our nation and Africa as a continent. Our lives begin to end when we become silent about things that matter to us.
Okay, you're welcome, ladies and gentlemen. My name is DJ Country.
The usual.
Yes, and I'm with my guy here,
German, Patrick Majid.
Yes.
You already know, right?
Yeah.
In case you've just joined us today, what did you join lelo ndipo wayo na podcast? Please bwelela tiko na first episode or what you do, just follow our page and you'll find it there. And then introduction yanga ngona imisa I was like page otherwise pasani ya mwisho. Because I'm sad. I have a lot of problems that need to be half shared.
Okay.
And probably have solved. Maybe, I don't know.
Yeah.
But no, this is the problem I have.
Okay.
Right? Maybe you can just help me understand because I feel it's a problem. I was in Mufue, a few weeks ago, and I was like down with malaria. And I went to this health center. It looks very small, probably like very small anyway. I didn't even know who looks like a nurse because it's one of them a dasta coat.
Okay.
Yeah, this is like a saddest situation I was found in. But anyway, that's not the case. I didn't find out if they have any at level 1, this level like we have in Lusaka.
Okay.
What's the difference between that kind of a setup and the level 1? I don't know.
Okay. I think I'll explain that in detail.
Please help me.
Just in a minute.
Okay.
Yeah, for now, my son wants to our podcast. Today, we are going to discuss the theme of our podcast, which is a problem shared. Is a problem
solved.
Half solved.
Yeah.
So idea very podcast here we are trying to bring an issue on the table. Health from Zambia. So that it is discuss.
Yeah.
When we table this issue, discuss this issue, I'm sure we all understand and how it's happening. And it's the first step to finding a solution.
Okay. I get you.
So
you're smart.
Yeah. So
you used to pass at school, I can tell.
Yes.
You have a lot of information. I'm a learner, so this guy sounds a lot of informative. Please go ahead.
Yeah. So the idea is sharing. Okay. So those that have experiences, have got things to say, have got opinions, please come through. The number in Peter Pan's screen here. Hey, please send my WhatsApp. Then we'll be reading them here. If they are voiceovers, voice notes. Sorry,
voice notes.
Yeah, we'll be playing them here.
I think the DJ at voiceover. DJ Country.
That's about DJ.
Yeah, but anyway.
Tizambo challenge. So basically today we are discussing about the congestions in clinics and hospitals here in Zambia.
Wow, congestion.
Yeah. So which party kamba Majid, what's the difference between one hospital and these other
hospitals, clinic or
that's what we're going to look at today. So I've got a lot of questions for you.
Okay.
Just be ready.
I'm always ready, man.
Yeah. So in Zambia, hospitals are categorized in this way.
Okay.
Actually, this research here says there's first a specialist hospital.
Okay. That's based on our research anyway. So please just follow us based
that's
on our
research.
That's the first
one.
Okay.
Then there's now the level 4 hospitals. Okay? And these are teaching hospitals. And there's level 3 hospitals, which are general hospitals.
Okay.
Then kuli na ma level 2. Yamene ni ma hospitals yama provinces.
Okay.
Then kuli na ma level 1 ni yama districts.
Ndi tungono.
Ma hospitals.
So it's vice versa. Level 1 ni shinge tungono. And then level 4 ndi fukuru.
So then kuli na ma clinics.
Okay.
Then kuli na ma health posts. So I think iyo yamene mwenze ko imwe. Iyo ni
level
ni ka health post.
I like that.
So so I think that's why maybe benzili bina amataya bwino.
Yeah, man, it was my, and you know, nenzina malaria. I want to say malaria, and they ended up giving me quatem. Now, like after like 30 minutes, we were there, a bunch of us, and health practitioner. Obviously, since I'm a nurse or a doctor, but then they put
okay.
Yes, and do about issue a lot.
Okay.
Yeah.
My level 4 hospitals in Zambia, Tilinaimozi, which is UTH. Because it's a teaching hospital.
So level 4 can give vikulu. So chikulu tichina chimozi.
Zambia.
Wow.
Okay. Njalo sekasana. Iyo wao sinatoke bwida.
Andaba sabe. Ndiyatoka kofi.
Okay, then my level 3. Yeah.
Viewers take notes.
My level 3 hospitals, we have 8 in Zambia.
Okay.
That includes UTH. My level 3. Pali number 1, pali UTH, which is in Lusaka.
Okay.
Pali number 2, pali Levi, which is also in Lusaka.
Obvious. Okay.
Yes. Pali number 3, pali Cancer Diseases Hospital.
Which is in Lusaka.
Yamene ili futi mu Lusaka. Pali number 4, pali Ndola Central Hospital. Yamene ili kundola. Pali number 5, pali Kitwe Central Hospital. Ili kukitwe. Pali number 6, pali Chainama Hills.
Lusaka.
Ili mu Lusaka. Easy.
Easy big.
Then pa number 7 pali Arthur Davison Children Hospital in Ndola. Okay, Ndola
Children Hospital.
Then pa number 8 pali Livingston Central General Hospital.
Nishia kwana.
8 hospitals.
Chikwepe chavala. Imundeti nayo mu Zambia.
Ndiye ma hospitals.
National Republic of Zambia. Okay. Cool.
Then these hospitals, I want us to take note. I am a hospitals yali 8 in Zambia ti na provinces yali 10. Okay, but pale yali 8 yali 4 yali mu Lusaka, which is UTH, Levi.
Okay, ladies and gentlemen, listeners and viewers out there, please. This is based on our research.
Yes.
And then nowadays life it is simple.
This is based on our research.
Just Google, you'll find a lot of information out there. So, wow, Utakurisa, what do you think?
So, before I go anywhere, before I move on, what do you think about the fact that the whole lot of Zambia has got 8
it's heartbreaking
hospitals and nishtina mapatani yali 10, then yali 4 yali mu Lusaka?
It's heartbreaking. Like for me, I know I'll pick your children. So that's obvious. That's the only hospital right?
Yes, it's the only children's hospital, but every hospital also Ilion's hospital imangala na the branch yabana, or what they call a wing yabana.
So kunango kakwa sabe no kaza mukenaona kaza.
But here so far it is the only hospital yabana.
I think ijainaona yake kulbe yabana. This was just like, it looked like a 2-bedroom dada. I think because there were additional blocks here toilet. So I had to do a survey, and I was like, oh my god. Because obviously I wanted to feel maybe about on Karabaningi. So now, how many children do we have in Zambia? I want to pose this question. How many children do we have? Approximately, we have a lot.
Approximately
5. So in Faka in 5 only.
I can imagine. Because that's only you.
In Palwanga.
5.
And think in hospital most. And you are telling me about my branch. Okay.
Imagine. So like looking at the number of hospitals here, in Nakula kwa Zambia. And it means that Lusaka has 4, right? Meaning the rest of the nation has 4.
Bagabana, how is the division?
So I think this is where the main problem is coming from. You know, where like the whole lot of Zambia, going only to these
4 hospitals.
4 hospitals. And Lusaka already is congested on its own, so you can't really rely to say no. I'll go to Lusaka.
You can't. In fact, just imagine someone from where I was, which was in Mufue. Then they get sick. You said to cancer hospital. Mention about cancer. How many hospitals? Probably it's the only one, right?
It's the only one.
So somebody should travel that far.
Imagine.
With their own money, probably, our community, and we understand our economy, and so not everyone who manages obviously 3 meals in a day.
Yeah.
And now you have to travel.
Yeah.
To seek that cancer medical treatment.
Yeah.
To this one also to hospital, excuse me, which you are going to find it congested, because that's what we are talking about.
Yeah, because the problem is the number of people that we find in hospitals. Because for example, if you go to UTH, they even put other mattresses on the floor.
Pants. Yeah, I've heard of that story. I've heard of a story where some mothers.
It's not a story, it's reality.
Okay.
Yeah.
I don't have to share it. It's reality. I'm sure somebody anapita over, so please remember to just type in that number you put up a screen, send us your situation, and we would like to share.
And then as if that's not enough, according to our research, here it says that UTH kulima bed ema patients yali 1,655.
One pin. Yes.
1,655.
If that's money, 1,600.
Yes, 655. Near my beds. Then number 2, because UTH near in the highest. Okay, let's take note. Number 2, pali Levi Mwanawasa Teaching Hospital.
Lusaka.
Okay, Lusaka. Come on. Ilina 826 beds.
Chikuru chonse chiyakanzi ndi mabedi ali mozabi. Okay.
826 beds.
One thing that yes.
Then number 3 pali Ndola Central Hospital, which is yeve ilina 800. Just saying 26 anyway. Yeve ina 800. Then number 4 pali Kitwe Central Hospital ilina 630 beds.
600.
Yes.
6 zaza.
Then Pabwera Cancer Disease Hospital ilina 252 beds. 252 beds, which is in Lusaka again. Then
so Lusaka bakona na vikulu fita.
Then na China Hills Hospital.
China ma very pakulu kai ko psychiatric psycho anyway. But we gonna a branch there.
I think it's the main branch.
Main branch.
Yeah,
psychiatric.
Yes. I don't know the other branches they have, but mainly it's the mental thing.
Okay.
Yeah.
I remember a friend of mine. This is crazy. Anagwa kumutengo. Then anas cheat like an drug Gilbert.
Okay.
Anas do and then tunafika kai moto kai booking. Senza zwa kwaenda. Sasa tupeleka kuja kwa soko tizeki. And then it was so interesting to just be there and watch them and see how others would want to engage in a conversation with you. But there were also a lot. And I was like, which told you that? Oh, what do I? So I had to ask someone that. Oh, so I had to go around.
Oh, okay.
Yeah, so ish. All right, now so this is my.
Okay, anyway, so I'm not done. Yeah?
Okay,
cool. Then there's also at Davison, the Children's Hospital. It's got 250 beds.
They're only
2 sorry, I said that one too fast. It in a 250 beds.
And you know how many children get sick every day? Someone will need to tell us.
Then kuli Livingston Central Hospital. Yeah, it are none.
Bunonga iseche mu pagugo mapa pesa siriko ka iriko but no, I'm just kidding. I've been there.
It are none. I think we've qualified. Because if we add these beds all together, you find that the number beds ni ngono maning compared to the population ya Zambia. Although sindi aeka because kuli na ma level 2.
Okay.
But you know mainly ukadwala mwimankalia nyako ati mainly we are referred to these hospitals.
These big hospitals, because of
so but you find that ma Zambians number ya maybe manitidi na number ya nitapeza muri research ya beds ya chepa maningi if we put it against
population,
which I think in kwa mene kuchokera problem kuru ya we also have my level 2, but my level 2 we only have 19.
Okay.
Tina 19.
Because no among us my level 1 it's the biggest problem we have to deal with. Go ahead and tell us my level 2.
My level 2. Yali 19. Then yali muma district.
Tungono pasi pa level 4.
Such as in St. Francis Katete, kuli Choma General Hospital, kuli Choma na Kasama General Hospital.
Okay. Kasama. Asoba kakangiwa ba level 3. Nishiwe ni
kufikwenda ku
kupelekewa ku 4. And then kai wankala mkasama bakukangiwa then kuza ni second drama. Or tikupata je. Yo kaja transfer. They don't even know the status of your finance. They don't even mind ko utamusunga madezi ngati ngamtandise point.
Yeah.
But anyway, so
let me just finish up here.
I need to heal.
Yeah, then there's over 80 level 1 hospitals. Then pali ya military ya tatu. So kweli ya zafu mozi
Saint I just want to clear. You're one of the smartest people. Just break it down so properly. So it means that every time tenda kuma levels fancy na numbers yenda yasepera.
Like no kai
yenda yapakira.
Yeah.
Yenda yapakira.
The number yenda ipaka.
Tungono tuenda tupakira. Panga tuntemba ese panga ma shop ya kuruka. Akujingira tuntemba.
Yes.
Which they know one day uzofunika kwenda ku shop.
Okay, so we have over 8.
Wow.
Then pali ya tatu ya pali moja ya zafu, mbili ya Army. St. Eugene ndiye ya zafu, then Arakani na Maina Soko ndiye ya Army.
Okay, in Nankarako.
Then yali mu Lusaka.
Yonsi ya tatu.
Yaba defense force yonsi yali mu Lusaka.
So ndiye problem number 1 nzangala nayo. For example, nzona mga ize number level chanja nize number apa ndiye problem kana nayo. These guys wamaenda kunkondo, wamadingana mabom kushungunuka kuskanga kusansa ka muntu ndingana mabullet. Waichina vyo hospital vitatu.
Waichina vitatu.
Vonse viche mu Lusaka.
Then yali mu Lusaka. So is it that you masoja baiche mu Lusaka?
I think the question, I mean,
why my hospitals? Yeah,
this is very when concerned.
Because I'm sure my soldiers are all over Zambia.
Wow, ladies and gentlemen, our viewers and listeners, but please remember to like, remember to share, remember to subscribe, because there is more. Because these are concerns. These are problems.
If you look at these numbers here, they are simply telling us how big the problem is.
Too much.
Okay, like for example, like Yaba Army, Lusaka. Okay, and then we have 8 level 4 hospitals, which are 4 of them they are in Lusaka. Okay, and then we are looking at the other 4 catering for the rest of the nation.
So it means that putting together.
Yeah, these numbers, like these numbers, according to this research here, I think this is terrible.
So iwakwaniza ndipa jabatauka paka ndeke kwala.
Maiona.
And then ndeke kake muziba imakaisa tikamba ndeke watwala.
And then this simply means that isanga tikwanise tonse. Hence the conditions in the clinics and hospitals. Wow. So as you, Majid, what do you think is wrong? What do you think should be done?
And thank you so much for asking me that, because if you remember in our previous podcast, you asked me like what could be your priority, and already what you've just broken down, all these explanations, you pass up that answer. Meaning that kuri bantu bese bashita prioritize health sector with the national budget.
I think now
let us know.
Yeah, now that you've said that, according to our national budget, P1 P1 here is so P1 here is the government. Yes.
Boma. You can't mess up with the government, you know that.
Boma.
You can't mess up. Just agree with me on this.
Then yes. Then
can't mess up.
Number 2, education.
Okay, please let me clarify this. Please, this is a disclaimer. Boma, stikushutana.
Yes.
This is consent chavi, but you tikusivadi mustinga Boma. Yopa Boma. Okay, yeah. So there is
Then number 3, Nepali health. Okay, so meaning health down.
See it go down. It is down because it's number 3.
Number 3.
So manje
then number 1. First, Pali Boma, then Boma and Rama is Ziria. Zakobati Boma is this a function where it's for the administration, proper function lead of the government.
Is this a function? So Boma can do like function if you go to
and me, I would love to know. Like, teach me Kireko, you don't know Mangala
So this is our, I mean, probably maybe not the president, but maybe let me just say the highest officer, the biggest man in the country.
But I'm sorry, man.
Budget, government for country, you have to get paid, right? So I'm gonna pay you.
Yes.
Yes. Then guys, it's a social media mono.
Yes,
the producer, Mr. Joshua, there. Brother man. Not forgetting myself. Because then they are pocket number one.
Fall first.
You know because falling.
Yes.
But then unga sevenze ngati yodwa. And then now this is okay. Then education is number 2. You can go to school when you're sick?
It's like Mangalati. So mwana sunga iwe sunga then make sure vana vanga vaende ku school
that's why education ikana number. So after tafoleshana I say tapasa na mkwepo na and then when the next education vana vanga let them go to school.
Yes,
wapunzile
then abafunza vina ngata nanga bamulenga bana TB
bamulenga elo imagine mine kumfuela like already shared bamulenga bana TB wabadi waende kumsana hizo maneno kera ngakuchipata
abura yanka bwana no even if we buy medicine for Mulenga
he won't survive.
Mulenga won't survive. He's already dead.
So let the dead die.
In fact, I used to want Mulenga when he's still healthy. Mulenga Zambia.
Those were healthy people, and then all of a sudden I said, "Repeatedly, kuchipata." We Mulenga tunakuza new die.
We'll take care of Mulenga later.
For now,
let the children just go to school.
You were going to take this child to school and do pass, and
yeah.
So, but
but on a serious note, I feel personally, I think this has to be looked at. Yeah, because I think health should go in pure.
Number 1.
I think we should find a way of how to prioritize our health.
Malaria because like that was a simple one. And thank God I was given some co-attempts after like 1 hour to attend until one person. But the next day.
Okay.
I needed the rest, the bed rest. I wanted to come my colleagues that, you know what, Patrick, you're not going to wait.
Okay.
So it means that we office is here over.
Yeah.
Then we debate patara at some point.
Yeah.
So why should we have number 1? It's better. My priority, our priority should be chipatara.
I think I think for starters, I think we should find a way on how we're going to prioritize our health because I know for those that banzat whenever they can easily access because they can go to private clinics, they can buy, they can do what, but to us yes, it's very difficult for us to
help us,
yes, to access
medical
so now I think batitandizire totitandizane prioritize cyane because tivutika mvipatara muli line there's queues in Spatara, then you are sick, you know, you are very sick vibaba then ulipa line also not line sees attended to anytime soon. You know, and then you get your chance. Now it's your turn, you enter there, you find a very very upset and angry shouting at you as if you are the police station.
Why could this time after
much worse and if you went there with an STI.
Oh, yeah. Bye, Papa.
Uzapuva. You know, and then this also contributes to the fact that Mama can go in. Mama clinics. Why? Because I hope.
Then fed up I'm like.
Yes.
But when idea hospital.
Yeah. So that's number 1. What are the other solutions you think can be done?
the only solution, like I said, and I'll keep saying this, number one, prior infrastructure invest.
Nishinio dura maningi ma hospital sumanga.
I think we need to find out. No, Mr. Finance or Elijah, Minister of Health. Maybe we can, I don't know, but we need to consult.
Yeah.
Maybe we can Google. Maybe was contracting hospital, clinic, or maybe not do that. So because but some can do that because it's number 3. What do you expect?
Muzapeza, the other fact is that my residential areas yambili mu Lusaka yalibe a hospital or a clinic allocated to a specific residential area.
It's in Makomboni.
Basically most mu Makomboni.
Tipeza tuetuja.
Like for example, ku garden could be clinic.
Could be clinic.
Okay.
And it's not so, part garden clinic.
Kulibe. Or Northmead. Na member kwa Northmead clinic. Ni karibu mbira.
Ni karibe.
So I think this is also another problem. Like Mumakomboni.
Let's build, invest mukumanga. Okay. I mean, we should invest mongene sa manchito. Tumambira kono they've employed a certain number. I don't know kind of million. How much to empower?
So then the other thing is that this is why this podcast is here. Please. So there's other alternatives like as solutions. There's other alternatives. I mean, we will bring these experts to explain more on their own. I mean, like my previous episode.
Yes.
Tanga palinganga, tanga pali ma pastors, ma herbalist. So we we'll bring them in so they also explain, because I think if we can start considering these things, tinaseko decongest
Pali bantu kaleta nikarufuna kuzwa mshe difference pali witchcraft na witch doctor. So
that one, yes.
I never sleep enough. I want to
and there's also a traditional healer. I don't know.
So what pata?
Yeah.
So witch doctor, witch, and a traditional healer.
Yes.
Witch doctor, witch, and hello whichever you don't need to describe for us. I'm with.
Okay. So unfortunately, time ya tisirida.
Sure.
Tafika kulas kwa episode yatu. But we'll continue this discussion in our next episode.
We'll have to.
Then imumwina my experiences na matani, we are still waiting to hear from you.
Send us our
you
WhatsApp.
Can check us on all socials. We are everywhere, YouTube,
Instagram,
yes, everywhere, Instagram, TikTok,
social Facebook,
WhatsApp,
number social Facebook.
So you can just reach us there.
Please.
Number ngati ni utuma ma voice notes yanesko yanipita pa screen hapo. 2 million. So that very soon we start also bringing you in, you guys here. My experiences here pano. Then naye mubane muliko na matenda mudwala ya mene muli uncomfortable. Kuuza baziburu watu.
We can be your godfathers. Come to us.
People can respond on person through this podcast.
Because that's a problem shared. And it's going to be half solved.
Remember a problem shared is a problem half solved. We are saying our bye-byes. My name is DJ Country.
It's your boy Patrick Majidi.
See you on the next episode.
And please, disclaimer. So we're not attacking anybody.
We're not attacking anybody.
But all this information that we've given you, we
are trying to find solution.
Then please I think
please come through. Yes, please come through. We need more information.
Sure. Okay. Until next time.
Bye.
Bye.
Kuna chogera manimo